Good morning. Today we're going to look at the Chapter 2 coding guidelines. The first guideline has to do with treatment directed at the malignancy. And you're going to see as you move through some of these guidelines, there's treatment directed at primary malignancies, there's treatment directed at secondary malignancies, which are malignancies which have metastasized from the primary site, and there's treatments directed at complications of the malignancy, like anemia or dehydration, or complications of surgery. So where the treatment is directed is how you know which guideline you're going to apply. In this case, the treatment is directed at the primary malignancy. That is right here in the diagnostic statement. And then I have here the codes for you and the index pathway that shows you. When I looked up malignancy, it took me to the neoplasm table. You will almost always start with the table of neoplasms if your malignancy is specified. But if words like adenoma are used, then you have to start in the index to find your terms. Also, leukemia is in the index. It's much easier to find it there than it is in the table of neoplasms. But in this case, this patient has stomach cancer primary that has spread, which is spread to the retroperitoneum and the peritoneum. So you see that in the table of neoplasms, I'm in the malignant primary column to find the code for the stomach cancer. And then I'm in the malignant secondary column to find the codes for retroperitoneum and peritoneum. Now, because those two, retroperitoneum and peritoneum, have the same code, you're only going to use that code once. All of that just to say, and we'll give you an example of a guideline when the treatment is directed at the primary malignancy. The next guideline has to do with treatment of a secondary site. This is when the cancer has metastasized or moved to another site. In this scenario, the patient's admitted to the hospital for treatment of right lung cancer, which has metastasized from the prostate. So the prostate was your primary cancer, and the right lung is the malignant secondary. So when you go to the table of neoplasms, you're going to look up those neoplasms, taking note that the lung cancer is in the malignant secondary and the prostate is a malignant primary. The dash there after the C78.0 tells you that additional characters are needed. For example, that's just the lung. So the additional character of 1 is needed to identify the right lung. This guideline has to do with anemia associated with the malignancy. Anemia can be associated with different things, and in this case it is specifically associated with the malignancy. And the guideline tells us that when the admission is for management of anemia associated with malignancy and the treatment is only for the anemia, the malignancy is coded first and then the anemia. So I have here the table of neoplasms showing you the colon cancer is a malignant primary, and then the anemia is your main term in the index with or due to neoplastic disease. Neoplastic disease, neoplasm, and malignancy are all terms that can be used interchangeably. Now, I mentioned earlier that anemia can be associated with many different things. The anemia in this example is associated with the chemo, immuno, and radiation therapy. It's not uncommon for these therapies to knock out red blood cells in the bone marrow so that the patient then becomes anemic, and that is specifically related to the administration of these drugs or radiation. So our guideline is if the anemia associated with these therapies is being treated, and it's the only thing being treated, then your anemia is sequenced first, followed by your code for the cancer, and then the adverse effect code, which is T45.1X5. You see that I have a note there that the adverse effect associated with radiation is different. So you just have to go back to your guidelines to read about that. You see in that T45 code, there are 7 characters. That A at the end of that code has to do with the initial encounter. This is an initial encounter. And in the case of chemo, immuno, and radiation, it's going to stay an A because it's an initial encounter as long as treatment's being delivered for a condition. So in that case, I can't think of a good example where you would use the S or the D. There probably are there, but for this case, when you're looking at initial encounter, that's all you're going to use. This guideline has to do with the management of dehydration due to the malignancy, and the admission is solely for the treatment of the dehydration. You're going to code the dehydration first and then the malignancy. You see where the guidelines come into play here? Because normally you might think you would code the cancer first, because that's the reason why the person's having these problems. But we have to always code to the guidelines, which means unless you're going to follow a guideline, you might incorrectly put the cancer code first. And this guideline is saying no, if a patient's being admitted just for the dehydration, even though it's due to the cancer, you're going to code the dehydration first. Your sequencing directions are given in that guideline. This guideline has to do with previous excision of a malignancy. Say the patient here has a history of breast cancer and had a radical mastectomy on the left 2 years ago, has no current treatment, but bronchoscopy has shown that that original breast cancer has metastasized to the lung. So the lung would be your secondary malignant cancer. The breast would be coded as a Z85.3. The breast cancer would be coded as a personal history of breast cancer because she had a mastectomy and is getting no current treatment. So the Z85.3 just tells the reader she'd had cancer of the breast, but she no longer has that. The secondary cancer, though, would still be coded, and it would be first because this is what she's been admitted for. This guideline has to do with a patient admission or encounter solely for the administration of the chemotherapy, immunotherapy, or radiation therapy. In our scenario, the patient is admitted for round 2 of an immunotherapy and a chemotherapy for treatment of his chronic B-cell lymphocytic leukemia. Following our guidelines, I've selected the encounter for the chemotherapy as our principal diagnosis, Z51.11, then the immunotherapy, Z51.12. The guidelines tell us either one could be principal. I just selected the chemo to be principal. And then the chronic lymphocytic B-cell leukemia is C91.10. Leukemia is one of those things that you're probably going to be looking in the index versus the neoplasm table. It's just easier to find them there. And the next guideline is for the same type of thing, only this time the patient's developed complications. So the patient's being admitted for either radiation, chemo, or immunotherapy and develops complications. In the case of our scenario here, the patient's admitted for the purpose of radiation to treat brain cancer and develops uncontrolled nausea and vomiting. Following our rationale, this is an external beam radiation, so the principal diagnosis would be the Z51.0 encounter for radiation therapy, and then you would also have a code for your nausea and vomiting. But because we have to say why we're treating this cancer, I would identify the cancer through the neoplasm code of C71.9. Nausea with vomiting is R11.2. As I said in the previous slide, the guidelines do make a distinction between external beam radiation, which is what this is, and the patient having radioactive elements inserted. That's called brachytherapy. You notice that if the brachytherapy is used, the principal is then the malignancy code, followed by any codes for the complications. This guideline has to do with cancer in a pregnant patient. I'm giving you an example here. We always would use that 09A.11, and then your 6th character in this case is your trimester. The number 2 indicates the 2nd trimester. And then I'm giving you there the guideline. This guideline has to do with the pathological fracture due to a neoplasm, and the patient's being treated for the fracture. You would code the M84 category code. The pathological fracture would be your first code, and then the cancer would be your second code. This is true because the focus of treatment is the fracture. If the focus of treatment had been the neoplasm and the patient just happened to have a pathological fracture, then the cancer would be sequenced first, and then the M84 category code. Our current malignancy versus a personal history. You see here the patient is undergoing chemo after a right mastectomy 2 weeks ago. Even though the breast has been removed, as long as she's receiving active treatment, we will code the breast cancer. So I've coded the breast cancer here. There's your table of neoplasm. I also coded the absence of breast to signify that she has had the mastectomy on the right. This has to do with malignant neoplasm associated with a transplanted organ. Patient has cancer of the right kidney, and that right kidney was transplanted last year. So you're going to use the T86 category code to signify the complication of the kidney transplant. And you're also going to use the C80.2 code per your guideline, which is specific to a malignant neoplasm associated with a transplanted organ. And last of all, you're going to add your kidney cancer. So you have all three codes, and they would be sequenced in this order. If you have any questions about the guidelines, please post them in discussion board. If you have a specific scenario you want to discuss, please tell me which path you've used to try and find it. The next several slides have to do with the screenshots that I've taken from this book. So they're here. I'm not going to go through them, but they are here if it's helpful to you. I will not be doing this in future podcasts, but just to give you an idea of this book, and if you're interested in it, I encourage you to buy it. Okay, that's it for today. Have a good week.